2014, I was diagnosed with a terminal inoperable brain tumor, glioblastoma multiforme. After a bit of deliberation and research, decided to opt out of standard of care because what they were offering me was a really poor quality of life. And the quantity of life as well was very, very short. They said 6 to 9 months without treatment. Was it like 12 months, 12 to 15 with chemoradiotherapy, and then all these side effects and the fact that I may become impotent kind of put me off as well.
Yeah.
So my idea was if I'm going to die, I'll die well. You know, feeling generally quite well in my health, rather than being suffering and going through a lot of trauma just from the treatment course.
Yeah.
So, I mean, it took me, they said it would take a lot of time out of my life. So it'd be like 6 weeks, I think, of treatment on and off. And if my blood cells, they decrease, you know, my white blood cell count goes down, then I wouldn't be able to have the treatment and all this stuff. And I was just like, why would I put myself through this? So after doing some research prior to that meeting, in fact, like, the issue was like, so they got some office scissors because they couldn't find a shaver, and they spent about 45 minutes cutting my beard off. And then when I got in the room, they molded the mask to my face, and I kind of went along with it because, you know, they're professionals. I was like, I can't really say no. But when I was on the table underneath the machine, getting measured up, so I was all lined up and correct, so they got all the settings, I felt a pit of fear in my stomach, like pure fear and dread, and I just said, I can't do this. Thankfully, my instinct kicked in. I said, I want to talk to my oncologist, and then I got all my answers. You know, you may become impotent, you'll lose your hair, and I was like, I don't want any of this. And another image popped into my head of my grandfather. He died of liver cancer. On his deathbed, I went to see him with my mum, and he was completely vacant. He did not recognize her. He was skin and bones. There was no muscle. He just wasted away due to chemotherapy and radiotherapy. And that image it's part of the dread that I felt. I said outright, have you had the ketogenic diets? And she said, yeah, I've heard of it, but I don't think it's going to help you at all. Mind you, this is 2014, and it wasn't unheard of being used for cancer patients at all. It's more used for children with epilepsy. But I made, I put 2 and 2 together, and I was like, you know, if it's anti-inflammatory, why wouldn't it work? And it's a healthy brain needs fat.
Yeah.
So she said, yeah, it's not gonna help you, and I said, I'm gonna take my chances.